I call the member for Dunkley.
Thank you, Deputy Speaker. Speakers on this side of the House before me have raised one of the concerns about this bill is that it doesn't cover in-home care. I just wanted to raise another issue that has been raised with me in my electorate, which is one that I'm sure the government will take note of and work to make sure it's addressed before aged care facilities are asked to implement this new scheme. And that is a concern about making sure that there is certainty about how the scheme is to be applied and what sort of serious incidents it covers. So it's been raised with me that the current documentation, which is available on the departmental website, has some ambiguities to it about neglect and intentional and recklessness. And it is, of course, the case that there are a number of incidents in aged care facilities which result in serious injury that don't fall into a category of neglect or intention or recklessness, but are a matter of accident. And it has been raised by me concern to make sure that there is guidance, because it is the case that people who work in aged care want this guidance so that they can make sure they are giving the best care where they can and that they are reporting incidents where it's appropriate and are not taking up a lot of time and scarce resources where it's actually not necessary for them to report incidents. So it's not a criticism of the legislation, but it is simply a concern that has been raised with me that I wanted to put before this House so that the government can consider it. And I'm of course very happy to forward more details of that concern to the Minister if they are interested. I want to just turn to speak to the second reading amendment and, of course, the fact that the Aged Care Royal Commission shone a light on many of the serious incidents that need to be addressed, but did more than that. It shone a light on how badly neglected and underfunded the aged care system is and has been for some time. And it is something that should cause shame to all of us to have an interim report where commissioners say that, and I quote, "Many people receiving aged care services have their basic human rights denied. Their dignity is not respected and their identity is ignored. It's a shocking tale of neglect." We had an Aged Care Royal Commission in this country because our communities would no longer accept this neglect of their loved ones, because our aged care workers would no longer be silent about the way low wages, poor conditions and precarious employment often prevents them for providing the care that they want to and also living the sort of lives they should be able to live. And because brave Australians from across the country wanted their voices to be heard. It is those people and everyone who joined the campaign to force this government to finally call a Royal Commission to whom we owe our thanks. And the interim report of the Royal Commission and the hundreds and hundreds and hundreds and thousands and hundreds of thousands of Australians who wanted their voices heard and wanted the aged care system fixed was all before hundreds and hundreds and hundreds of Australians died from COVID last year while in residential aged care under the Morrison government's watch, where, in the stark words of Peter Rosen QC, the senior counsel assisting the Royal Commission into aged care, the evidence would reveal that neither the Commonwealth Department of Health nor the aged care regulator developed a COVID-19 plan specifically for the aged care sector. And it was August last year that the leader of the Labor Party, the member for Grainler, stood at the press club and, in the absence of a government plan, offered 8 points that the government could consider. Offered for the government to consider minimum staffing levels in residential aged care, reducing the home care package waiting list so more people can stay in their homes for longer, because we still have over 100,000 Australians approved for residential home care waiting for their package, and the Department of Health says that more than half of them are eligible for the highest level of care. Ensure transparency and accountability of funding to support high-quality care. It should be the case that aged care providers who receive taxpayers' money have to acquit how they spend it, and how they spend it on care for the people that are in their facilities. There should be independent measurement and public reporting as recommended by the Royal Commission. Every residential aged care facility should have adequate personal protective equipment, better training for staff, including but certainly not limited to infection control, a better surge workforce strategy. And in August of last year, the Leader of the Opposition's recommendation was that additional resources go to the Aged Care Royal Commission so that they could inquire into COVID-19 across the sector, but not impact or delay handing down of the final report. We've seen little willingness from the current government to adopt any of those minimum and sensible recommendations. And I know that the people of Dunkley have had enough. They tell me over and over again that action needs to be taken on aged care, because they know we didn't have a Royal Commission because this Prime Minister or this government wanted one. They know that we had a Royal Commission because eventually the Prime Minister and the government realised that they had no choice. And in less than a month, the Prime Minister and the government are also going to be put in a position where they're not going to have a choice, because the Royal Commission is going to hand down its final findings and recommendations. And this government cannot simply stand up and say, "Oh, sure, we accept that," and think that that will be enough. What Australians expect and deserve is a government that will implement reforms swiftly and will fund them without reservation. After 7 years of presiding over systemic and ongoing failures in Australia's aged care system, this Liberal government cannot continue to deny responsibility, it cannot underfund the system, and it can't pretend that the serious and shameful problems don't exist. When we have Royal Commissioners who say that, and I quote, "Had the Australian government acted upon previous reviews of aged care, the persistent problems in aged care would have been known much earlier and the suffering of many people could have been avoided," then there is no excuse not to act. We cannot have government that continues to put band-aid fixes on the run. It is not good enough. And that's not my phrase, band-aid fixes on the run. That's the Royal Commission's phrase in its interim report titled Neglect. It is an abrogation of one of the most fundamental responsibilities of government, to care for those who can't care for themselves, to protect Australians when they face dangers that they can't defend themselves from, and to be on their citizens' side. Australians expect that they're entitled to the best quality level of care in aged care homes. And the Royal Commission has been clear that more is needed to enable providers to meet those expectations consistently. More funding. But I also challenge the Morrison government that here's some other things that are needed to help Australian citizens, to ensure Australian citizens get their expectations met in aged care homes consistently. Acknowledge not only what you want praise for, but where you have failed, and take responsibility for fixing it. Fund the system properly, because if we can't do it now, when can we do it? Address the pay and the conditions of workers and minimum staffing levels for the sake of the workers and for the sake of the people that they've dedicated their working lives to care for. It is not too much to ask of an Australian government that it ensure senior Australians have dignity and meaning in their later years, no matter how many resources they have available to them and no matter what their personal wealth is. What Australians need now is a federal government that demonstrates through actions and outcomes, not announcements and spin, that is truly on their side. And I challenge the Morrison government to be that, but I can tell you this, a federal Labor government will be that and will be on the side of all Australians. And the people in Dunkley know that I will continue to stand up in this place every opportunity I get to say we have to fix our broken aged care system for the sake not only of the people that are there now, but the sake of people in the future. And I want to end this contribution by raising a positive example of an aged care facility, because we do hear a lot about where things go wrong, and that does have to be fixed. But sometimes we have to also raise the facilities that are great and where things are going well. And Baxter Village in my electorate, and I know that Kim Jackson will be slightly embarrassed for me to praise her and her staff so publicly in the parliament, but they deserve to be praised. This is a facility that at the start of last year sat down before the federal government had taken steps to deal with the pandemic and said, it looks like we've got an issue. How can we make sure we're prepared for it? Took out their old SARS plan, took out their infectious control plan, talked with their residents. Before masks were mandatory, had staff and medical staff wearing masks. Educated their wider community about what was required to keep their residents safe. They did an amazing job in the face of the same difficulties that staff and facilities across Victoria and across Australia did, and they did it well. And I want to make sure that they are remembered for how well they did it. And as Kim has said to me, aged care is about people. Our approach, as with everything we do, must value those people at the centre of every decision. And that is a guiding principle that works for aged care, and it's a guiding principle that should be adopted by governments and works for government. People should be at the heart of every decision. And in a year where Australians fought fires, floods, and as Kim Jackson has said to me, microscopic enemies that we couldn't see, we need to make sure that we learn from that people should be at the heart of every decision. Thank you.
I thank the member for that contribution.